Hello, everybody. This is Claire at StudentRDH. Today we have Diana. So welcome here, Diana. Tell us a bit more about yourself.
Yeah, sure. So my husband and I have 3 young kids. We have two sons who are 6 and 8, and then we have a daughter who's 11. So 3 little kids. We have been in Utah for about 7 years. I grew up in Washington State, and once we got married, we kind of traveled around quite a bit and found ourselves in Utah. And I started my prereqs about 3 years ago. I actually have a bachelor's degree in education already, but I decided that I wanted to go back and pursue dental hygiene. Yeah, so I'll be a student at Weber State University in the fall.
In the fall, okay. So you haven't started yet?
Nope, I haven't.
Is that correct? How are you feeling now about, when is the start date?
August 24th.
Okay, so it's in about a month and a half. Good. So tell us how you're feeling right now.
So I'm super excited, but I'm also nervous, of course, especially with all this COVID. It kind of makes everything up in the air with my schooling and my kids' schooling, and just waiting to hear, how everything's going to play out.
Sure. And you're saying your schools, so are they going to be homeschooled? Like, do you have any clarity on that right now?
So my schooling is, they changed the status to flex status. So they're still trying to figure everything out, but it looks like at least part of it, classes will be offered online. Probably a lot of, video classes and stuff that we'll see. And so.
Okay, so it seems like you might also be responsible for your kids' education as well.
Yeah.
To a certain degree. Okay.
Yes. So my husband has been working from home, and that'll be really helpful. Ever since the start of this COVID, he's been home, and so he'll be able to, be home for the kids. And
all right. All right. I'm just hoping everything will go well. Now, So, describe us a little bit what you are anxious about, with the school, like starting school.
I think I'm definitely a planner. I'm a list maker, so I like to know what's going to be happening before it happens, and kind of, figure things out, know in my head what can be expected. So just with all the uncertainty, it just makes me a little anxious. But then, of course, with the 3 kids at home, just trying to plan my time accordingly.
Time management,
Right, super busy, and making sure I can fit in.
Okay, so, actually, in a way, I want to invite you back with having a discussion with people who are in the program right now. I think that would be really, really useful as well. But, me, I'll tell you everything about myself as well. So I actually graduated school pretty late, like dental hygiene school. I did it just like you after I had my degree already. I had it in business. I actually even had my master's degree before I started dental hygiene school. So I was like kind of an old student in my school. So I graduated in 2013. So that's about 7 years ago. It's not that long, if you really think about it. I really dived into the exam prep because I love this. And I've been an educator before I even did dental hygiene. So it kind of felt like a good fit for me. But, after all this, even going to school for something else, like you already have an education degree, it is a lot actually, because you probably heard that, right?
Oh yeah, many times.
I feel like the difference is that, you're seeing patients. So it's all about patient care. So, doing your homework and all that at home by itself, okay, it's manageable. But at the end, we're learning all this. Plus, we have the stress of being in clinic with this crazy PP that's going to go on as well. And having to really manage the patient too, because sometimes they don't show up. You have your requirements, that's a big stress, right? What else? There are some areas when you don't feel comfortable because it's all like a personal relationship, right? So it can be a little tough in that sense too. So, I do feel like we stress a lot. I mean, I did stress a lot because of that part. Like, I honestly, I remember, I hope everybody's over drinking age, but I remember I came home and I just needed a beer. So, I think just by even thinking about, okay, like clinic is going to be stressful, like it's not going to be easy peasy, because, and the faculties, what are they doing? They're like trying to make note of every little thing.
Mm-hmm.
So tell me, in your education degree, or when you were at school, the faculty members you had, were they very critical, or were you more like left on your own to finish your homeworks and things like that?
No, I think we had a mix of both. So my undergrad is in art education. So we had a lot of projects that we had to complete and turn in, and feedback for those. And I remember a couple professors in particular that were pretty critical, but also gave good feedback so that I could do well.
Okay. All right. Honestly, one thing I would say is, like, I think faculty members in dental hygiene are super critical. So, down to the sock, like I was shocked. I'm wearing socks that I want, but it wasn't that. It's like, you got to trim your nails. And I felt in a way that I was very micromanaged. But, the higher standard for the school they have is a little different than private practice. When you go to private practice, it's like free for all, like, I mean, not free for all, but it's much more relaxed. Right. Yeah. And you said you were a little concerned with time management. Is that correct?
Yes.
Right. Is that because you feel like you won't have enough time to juggle everything?
I think just with the course load, trying to learn everything, retain all of that information that we're going to be asked to learn, and then, be able to recall that information as needed.
That's because, you're going to have head and neck anatomy. How many veins do we have? Like a freaking lot of veins and muscles and everything, right? So, I mean, obviously, whoever knows me by now know that I love, love, love memory techniques. Did you get that impression from me yet?
Yes. And I loved it as well. I went through your course, your wake up memory technique, and it was amazing. So
awesome. I appreciate that. So you already went through the course when you are still trying to start school?
Yep.
You are so prepared. I mean, I have no doubt that you're going to do awesome to begin with. And, can I just talk a little bit more about how to be an effective learner? Because I think that goes hand in hand with like how, you can manage your time. And you probably know a lot of it by having, your education background as well, is that, when you're learning, I feel like we really need to put some context around it. So I continue to learn about learning from like the masters, the psychologists, people like that. And one thing, so this is a study that they did, right? They gave people a list of like how the washing machine works, kind of like, step. And then there was a group that was not given any context. They were just given the content, like A, B, C, D, and E. There's another group that did the same, but at the end, before they were tested, were given the context saying, this is actually about how the washing machine works. And the third group did they were given the context first, and then given the details. And then they took the same test. And, guess who did the best? Is the one that got the context first and then the details. Because I'm saying this because I feel like when we are in dental hygiene, like there's so much to learn. So it's going to be like things piling up on top of each other. It's like in your closet, mixing your t-shirts with your socks is going to be like a bunch of everything. Right? So I think one of the things I can say is, if so before you sit down, before you even go to class, like remind yourself, this is perio today. This is the perio textbook. And give yourself kind of it's a memory technique to give yourself an area that's about periodontology. So for you, it can feel like maybe the dental office, maybe that can feel like periodontology to you. Whatever, it can be a red room because perio is like, we deal with a lot of blood and inflammation and all of that. If it's a pharmacology class, obviously we can go to the pharmacist, like, kind of give yourself this mental image saying, okay, I'm here now. And then even so, when you start learning, okay, well, periodontology, what about periodontology? Or if you're pharmacology, are we learning about high blood pressure right now? Or are we learning about diabetes? Like, instead of jumping into the details and get like in the details, I think that one step that takes half a second is something that I would love to teach more and more in the schools as well, because as the study shown, it takes nothing, but it's so much more effective.
Yeah.
So
no, that's a great visual.
Yeah. And when you're doing your quizzes too, like even your homework, like context, okay, I'm stepping back in the red room because this is periodontology. Okay. Yeah. And then, when you actually take the test too, when you forget, you get in the room then, like mentally, visually, and then you're trying to pull information out of that room. So you go back into, because we do that where when we forget someone's name, we're like, I think I met this person, you have 3 kids where we're like at the soccer play.
Yeah.
Right?
For sure.
Yeah. You do that, right? Saying, oh, I think her name was Karen, right?
Yeah.
So same thing. So when you kind of blink, you're like, I think I know, but I forgot exactly, kind of trace it back, because at the end, your brain is constantly recording everything we're doing. It does twist a lot of things, but it's still like very efficiently absorbing. We don't even pay attention, but it's like everything is coming in here. So yeah. Have you also thought about like getting a planner and making sure that you are tracking everything?
Oh yeah. The planner, I have the planner, it's all set.
Oh, is it? Did you buy something? Where did you buy it from?
So I just got it from Amazon, and it's called like the Simple Planner or something, but it has plenty of space and it has the time slots. So yeah, I have to have everything written down so that I can cross it off.
Okay.
Helps me be able to see and plan out my week and my day and everything. So
okay, because you like kind of the checklist style, and you're like, I'm done this, done. Okay.
Yes.
Perfect. I mean that definitely works. I mean, even me, I plan my day, to the detail if possible. Because we're humans, right? We do what we wrote. We don't do if it's just floating in our head, right?
Yeah, that's so true. Yeah.
And then what I ask our students to do is kind of trace back to like the end goal. So if the end goal is final exam, December 20th, try to just walk back and say, how many days do I have to even actually finish this chapter?
Okay.
So I have 3 days, 2 days, 1 day, but you have a plan already, so you can see, oh, this day I'm fully booked already. There's no way I can squeeze it in.
Yeah.
The next day, maybe I have an hour. Because I feel like by doing so, not only you are making a promise to yourself to like, okay, I'm going to put it right here in this slot, but also reduce anxiety, because in hygiene school, there's like a lot of anxiety. Like, am I going to pass the test? My faculty is going to like want to just check me out because, I didn't do blood pressure. There's so many things. So, by knowing that I'm actually having, taking my time to do perio, I have time before the exam date. I think that's also really critical. Do you know how many classes you will have in the first semester?
So I think I have 7 classes.
Okay. Ooh, 7. That's a lot.
Yeah, I can't remember if it's 7.
Okay, no problem. Every school is a little different. Do you know when you're going to start clinic?
I'm not sure yet. They're still figuring out schedule.
Second year, maybe.
Yeah, I think. Yeah.
Okay, so you're still okay. So yeah, I think the first year though, actually it's all didactic, right? I mean, generally you don't really see patients until when they think you're ready, which is probably the second year. So I do feel like in the first year though, this is what happens with the boards. You take all your head and neck anatomy and everything. And you know what? Second year, you forget everything that happened. Right? You're like, well, did I even learn this?
Yep.
Well, right? So, if you could like find a system of when you're done, okay, you can celebrate, but kind of go back and just, try to not forget when you go to the national board examination, try to prepare for that. I feel like it's going to be so much easier.
Mm-hmm.
Right. And, I talk about this Ebbinghaus curve very often, which is in the first day of learning, you're like at 100%. But at 7 days, how much do we retain after 7 days? You want to take a guess?
Oh, I can't remember. I can see the curve in my head, but it's not very. It's pretty drastic from that first day.
Yeah. So like first day, 50%, you're down. After 7 days, about 10%. So imagine like after a freaking whole year, I don't even know what percent we're going to remember of that, right? So that, that's one thing. And I actually seen this phenomenon in programs that are actually a little longer. How long is your program?
It's 2 years.
2 years. Okay. So I feel like 2 years is good. But, even like major universities that Hygiene is a 4-year program, they do intense science and all that. You know what? Very, very surprisingly, they tend to score even lower on the basic science. Why? Not because they were a brilliant student who went to a 4-year university. Why? Because it's just freaking 3 years ago. They just forgot and didn't have the time to invest when it was, so, it's not just about like the quality of the studying, it's also kind of the timing, make sure you kind of bring it back. It's like warming up your soup again, like you kind of need to warm up your head again, once in a while. And even if you're in second semester, you're like, oh, I learned head and neck in the first semester, and you just try to do a few quizzes, like you don't even have to score high. The brain already is just, making those connections again, or not, they get loose. They want to separate. You're just doing this again. I know it's a lot.
Yeah.
Mm-hmm. Yeah. What about, are there some of the classes that you thought would be more difficult than others?
I mean, for sure, probably pharmacology, just because I know there's a lot of rising.
Yeah. You're right. Pharmacology is it's a lot because how many drugs there is to memorize, like 100 of them at least, right? So I feel like when we are going to pharmacology, I mean, you definitely need to memorize everything. And this is, do you ever do like flashcards or things like that?
Yeah.
Oh, okay. Well, what I want to talk about the flashcard is that I'm going to tell you to please not do it.
Okay.
The reason why I say that, and you might actually have the better method, actually, I don't want to say don't do it ever, but what I have seen in students, because I do coach a lot of students, is that they take the time. Again, it's going back to time management, right? Writing is time.
Mm-hmm.
When you have your kids who need to, like, I don't know, go outside and run, time. But the thing is that when you're writing, you actually absorb a little bit. But when the focus becomes making cards, it becomes a hand exercise versus a brain exercise. So it's like I'm writing cards for the sake of writing cards. And then a lot of students are like, I'm going to review later. That's good. That's a good, step for me to prep. And then I'm going to review later. So what you actually did is spend all this time to prep. But you know what? A lot of times we don't even have time to review it later. Because life happens. School goes on. We're behind on our assignment. So what I'm trying to propose here is, when you're reading, just find one source. You don't need flashcards and this and some other sources in the textbook and that. Just find one source that's like you think the best, and really just like dive into that one source. whether it's the PowerPoint, whether it's the the document as StudentRDH, or whether it is, the textbook, instead of having 5 different sources for the same class, if you master one source, you're like 80% there already.
Okay.
So, I know, like, we all love to make flashcards, but if I had my opinion, I'd say use that time to try to memorize information.
Yeah.
Versus writing it down, or find more quizzes instead of making cards. So find more quizzes at the end of your textbook. Like, ask your faculty if there are extra quizzes. You can ask me as well, because when you're doing the quiz and you're critically thinking, you can go back to your notes and did I know that? Like that's actually one of the most effective learning, when you have a question and you're trying to solve it.
Right. Okay.
So again, if I had time, I would rather do some 10 more questions versus making cards or like very copious notes.
Yeah.
And I'm going to make, I had planned to do this for a long time. I want to make a course on how to take notes, because taking notes it's an art of its own.
Oh, yeah.
Right? You took notes before, right, at school?
Yeah.
You took a lot of notes?
Oh, yeah.
Yeah. Okay. And what type of learner do you think you are? Is it like, do you learn by listening, by seeing?
So I think a little bit of all of the above, but definitely hands-on.
Hands-on, okay.
Yeah, I just make the connection a lot easier when I can do it with hands.
Good. And that's, well, seems like you did some art as well, so it kind of totally makes sense. Actually, dental hygiene is not too different from that.
No, it's not.
Yeah. Is that kind of why you thought, oh, maybe I can do dental hygiene?
Yeah, they do have a lot of similarities, but I've always kind of been interested in dental hygiene. So, but yeah.
I feel like if you like arts, you like using your hands too.
Yeah.
Which what we do in dental hygiene as well.
Yeah.
Use our hands. Yeah. Because I think it's really important to realize what kind of learner we are. And most of the time, it's like 80% of, the population is a visual learner. Right? When we see, for example, I am on a call with a lot of people all the time, but if I don't see their face, like, it's easier to forget. Right. But if I see their face, I'm like, yeah, I don't even, have to dig deeper.
Yeah.
So, that's going back to the studying. So, you can, a lot of students try to draw. I think you're going to be awesome at that. But again, I like to ask students, say, what are you drawing and why are you doing it? Right. It's not just the process of drawing is going to be helpful. It is the content. And then, are you drawing it because it looks great right there, or because you think you cannot memorize it without drawing it? Right? So for example, the atria and the ventricle. So we have our heart, and you divide it in 4. Okay, A at the top and V at the bottom, because the bottom of the heart already looks like a V. Like, that's kind of just, for example. So writing that down, in my head, sometimes I'm like, we don't need to have time. We don't need to spend time writing this. Like, that's easy enough to kind of just get it like that by reading. But then maybe more complicated, there's like the nerve that come out of your ear, kind of like that too. So maybe those you can write.
Yeah.
So, because I do see, I went to school without having kids. So with you having kids, it's going to be, even more challenging to manage your time, right?
Yeah, for sure.
And at the school that you're going to be at, like, do you know until what time they go to class?
I think it's from 7:30 to 4:20.
Okay. Oh, that's pretty early.
Yeah. A long day.
Wow, that would be a problem for me. I wake up at 8.
I know.
What time do you wake up?
During the summer or on a regular day?
During the summer.
Yeah, it's around 8. I've been trying to wake up a little bit earlier though, since it's been so hot, to try to get some yard work done. But yeah, I'm definitely going to have to change my bad habits.
Yard work, wow, yeah. Better do it in the morning when it's
Yes,
cooler,
sure.
right?
Yeah.
Yeah, yeah. And I've seen this for a lot of students too who have, obligations, who have a family, is that they carve themselves time at the school after school, saying, I'm going to stay here for 1 more hour, but 1 more hour, I better do all my homework and I better like read all my chapters kind of thing.
Yeah, that's a
And
good
it's
idea.
like so effective because you're like, time's up.
Yes. Yeah,
So,
I've noticed with
yeah.
anything can take as much time as you give it. So if you give yourself a shorter amount of time and you tell yourself you've got to be done by then it can happen.
Yeah, exactly. And honestly, I mean, dental hygiene school is really complicated and, there's so much to do. But at the same time, like having this pattern, if you actually had this pattern, even like if it's a 1 hour per day, I feel like, it's better than, someone who's like, oh, I'm just going to go home and whatever, and I'm going to cram like 5 hours in a day. And our brain likes to spacing too, like who can cram for 5 hours is not very effective.
Yeah, for sure.
Yeah. So I mean, if you think you can do that, whether it's an hour earlier or an hour later, like it gives you puts you on a schedule. And that's what I do to myself too. Like if I have a task to do, I time myself. I have an hour to do this, period.
No, that's
So yeah. So, but at the end of the day, it's going to be difficult, but it happens anyhow, somehow, magically, and you all graduate and you all get to work. Right? It kind of feels like, I felt a little bit like I was going back to, well, how can I describe it? Because I feel, it's not just work on your own. And probably in your undergrad or whatever you studied before, it was a lot more independent. But dental hygiene is very scheduled. It's like you don't have the flexibility of choosing your classes. They're all set for you. And you cannot fail anything or not you fall behind a whole year. Like you cannot continue the schedule. Right? So that is, very strict in that sense. Yeah. I mean, feel free to just bring your own thoughts and, any other things that you were concerned about.
Yeah, sure. I think I had mentioned this before, but I know memory recall and information recall has always been a struggle with me. When I get put on the spot, I forget things. Things I do know it's not something that I have to dig deep for, but just because I get nervous. And I don't know if you had any tips on that.
Okay. That's an excellent question. And if you can master this right from the beginning, oh my God, life is going to be so much easier, right? It's a whole new skill that can be developed, Okay, so the whole trick here, it's not even a trick. That's how our brain works. Like we're supposed to give our brain the way it's supposed to, work. We're trying to just give it what it does best. So any memory you're trying to create, if it's a new memory, the brain cannot comprehend. It needs like 500 million repetition in order to achieve that. So sorry, I'm going to wave my hand again just because this thing is on timer. If I don't move around. Okay. So what I'm trying to say is the brain needs to use something it knows already and combine it with the new information. So you need to mold them together. You need to stick them together. So whenever you are trying to have, again, a new information, just try to think, what do I know already? So, for example, let me give you an example. So Do you know A1C level? Do you know what that means?
Oh, you're going to have to remind me.
Okay, so no problem. So A1C level is for the diabetes. So we measure the sugar level of those diabetes patients, blood glucose level. So that is the average for the past 2 to 3 months. There are many different tests, okay? A1C is one of the most popular ones. This one, you don't have to fast. Okay, so first of all, we learned about this concept, and you're going to learn 500 million definitions, okay? So A1C, what I just talked about, instead of just cramming it, jamming it in our brain, saying, oh my God, it is like 2 to 3 months average, you don't have to fast, and this is like glucose, but there are like 3 different type of tests you can do for diabetes, okay? So how do you remember this? So I would, for example, look at A1C. Okay, I'm looking at it. I'm like, A like the average, A like average. Because the other tests are like not the average of 2 to 3 months. They're like, you know, your right now blood average. That's why they ask you to fast, because they want to measure what's going on right now. So for example, you take something you already know, like A, and you say, oh yeah, A like average. Already you have this information that A1C level is about averaging 2 to 3 months. How do you know even 2 to 3 months? I don't know. You can think of A1C, there's 3 letters in it. You can think, okay, well, 3 letters, 3 months is the average of like 3 months. So you're trying everything here to find something that you know and connect it to the new information. You know, and for example, so the normal, okay, if you're considered normal, 5.7, and you need to be 5.7 and below. That's considered normal. Now you're going to learn another 100 different numbers about different testing, right? So now how do we remember 5.7? That's the big question. So again, we need to be creative here. Now 5.7, I don't know, 5.7 or 57, you need to find something that resonates with you. Do you have any ideas? Like anything crazy works, anything super personal works as well. We can do it right now together. So what do you know about 5.7 or 57 or anything in your personal life that happened that with those numbers? Or you know, a car pricing. I mean, I'm just making this up.
Let's see. I don't know. I'm bad at these.
Okay. And sometimes, you know what? I Google random things like that. You know what I just Googled? I Googled number 57 sports player. I'm trying to find a sports player that has a, you know, number 57. Like, okay, you know, I don't even, you know, really play sports or watch sports, but I'm like, maybe, you know, it will make sense over there. Or maybe someone who's 5'7", or, you know, something like that. You know, for example, I know my boyfriend is 5'7". So it kind of makes sense in my head. So I'm like, he's normal, like his blood sugar is normal, kind of thing. Or if we're, you know, for example, if number 57 of like whatever the New York Yankees, I'm making this up, okay? It's like whoever, so player that you can recognize. Okay. You don't have to see him in person. You just kind of recognize him. Then, you know, you have a connection. So sometimes it's a little more difficult. Sometimes it's easier. But the more you do it, like the brain is going to be so much happier to have this information that you know already and have a new information on top of it. This is like the speed vessel that's going to carry the new information in your head. Okay.
So if you had a series of numbers that you needed to memorize, like, for example, the teeth exfoliation and eruptions, and you needed to know the months and years and just something like that, where you're going to have a lot of different numbers that you have to memorize. Would you do that for each tooth and try to make a connection for those?
Okay. So that's excellent. You know, that, I mean, because that tooth eruption, that is, oh my God. Right? Actually, at StudentRDH, I teach you how to memorize it. So what I want you to remember is, for example, those bottoms are 6 to size. The first molar are around 6 years old. So you have landmarks, like you know that, like canines are 11, like those are landmarks. I mean, they freaking look like 11 already. So we have some landmarks. And what I teach at StudentRDH is actually, I want you to use visual now. I'm going to ask you to draw some things. Okay? I want you to, you know, for example, I'm going to ask, I have a video there. So draw this A like that and that. What it is, it connects, okay, bottom to top to this and that and that and that. So it kind of shows you what the next tooth is going to be.
Okay.
And you had the landmarks. This is 6, this is 11. So that's 7 because that's the next one. Then that's 8, you know. So for those who are just listening, what I'm trying to describe is we're going to just draw something that I'm going to ask you. And I create a whole story too. I said Spider-Man went up the stairs and then he kind of jumps up the balcony kind of thing. So you have this, you repeat the story and then you write your numbers. 6 over here, 11 over here, 15 over here. So that way, at least you can trace it back. Because if you're trying to just jam this tooth, 6 years old, this tooth, 7 years old, is not going to stick.
Yeah.
So eruption pattern it's a big one. It's like still one of the most difficult to memorize. Even for dentists, if you ask them, they don't know it by heart.
Yeah. Okay.
So, you know, that's one of the hardest. So if you can master that, I do really feel like you have a chance to really be excellent in every single topic that you will learn in dental hygiene.
Okay.
So again, the trick is so simple. We're going to glue what we don't know to what we know already. And that is going to carry us. And when you're trying to recall the information, you just need one or the other and you already have it. So you multiply your chances of getting that right. So if you kind of forget 5.7 or A1C level, you kind of just go back to, first of all, the context, okay? The context is right now. We're having a phone call. We're seeing each other here. We're learning together. So it's like, oh yeah, I think I had a call with Claire. And then you're like, oh, I think she actually even talked about A1C, like A like average. So you're tracing it back with the context. Yeah. And then, you know, you will arrive at like, oh yeah, 5'7", she talked about the sports player, but she talked about her boyfriend at the end of the day, you know. So, you know, those are kind of really enhancing your chances of doing something. It's like, you know, when you have a new recipe and you never tasted that food ever in your life, how are we going to make it? Like we make it, but we don't even know it's going to be good. But when you use previous experience saying like, oh, this is like a pasta, whatever that is, and you're like, oh, okay, that makes sense.
Okay.
Your kids probably learn like that too. I mean, when you tell them this is something like that.
Yeah.
Is that when they like understand what you're talking about?
Oh yeah, I do that all the time with them.
Yeah.
Even when we're meeting new people, I'll say, oh, they remind me of this person, or, you know, something like that.
Yeah, exactly. They are like, they look like, you know. Yeah. Well, or when they, I mean, I don't know, first trying to learn how to play basketball. I'm just making this up. I don't play sports. You know, like, you know, throw it like that. Like, you know, we always have an analogy.
Right. Yeah.
Okay. I mean, yeah, I'm really glad you asked this question because it's really fundamental in everything that we learn. Now, just a little bit about numbers. If you're very serious about this, there's a very special technique to remember numbers, actually. So for example, 57 to me, so I'm a memorizer. I'm a memory champion. I practice myself almost every day to be in national competitions and things like that. And I put this back into, you know, StudentRDH. However, for example, 57 to me is a lock.
Okay.
Like a locker lock.
Okay.
So there's a whole system to memorize numbers. So, you know, my credit card number, it's not like, I don't remember 457. I mean, I could memorize it this way, but how I remember is fluffy mouth, fluffy mouse, like a mouse, fluffy mouse, and sticky toes, for example.
Okay.
So what it is each number turns into a letter in the alphabet.
Okay.
So instead of memorizing numbers, you're actually memorizing alphabet, or like, 3 is an M, and 7 is a K. So if it's 3, 7, you're going to find something that starts with a M and has a K in it, like Mickey, like Mickey Mouse, Mike, like Mike, make, things, something like that. So, that's a system to learn. That's how I remember hundreds of numbers in a row. So
okay.
yeah, that's a different thing though. I don't think we need that for dental hygiene, because the most numbers that we're going to learn is probably the dentition, as you said. Yes. And Diane, I'm totally open to talk about anything you had in your mind today.
Do you have any tips on dealing with nerves when we get into either giving presentations or taking exams or things like that?
Yes, that's awesome. I'll tell you one thing, as cheesy as this sounds, it's breathing. So let me tell you exactly how to do this. And I have done this for past about 25 years of my entire life, even more than that. My pharmacology teacher thought I was cuckoo when I started hygiene school, because what I used to do, I don't even flip the quiz. I don't even look at the quiz. I get it. I meditate, like I'm just there. And he thought I either am a genius or I'm totally going to fail. All right. So he thought I was one or the other. So he wrote down my name because he didn't know, it's the beginning of the class. He's like, I need to see, what she's going to do. So, it's just a technique, because when you get an exam, or when you're doing something that makes you nervous, I mean, your heart is beating. What it makes you do is like your brain is just speeding, but it's going too fast. Like you don't have time to properly think. I mean, you probably see this with your kids too. If they're rushing, it's like rushing to brush our teeth. Are we going to get it done properly? No, right? So you need time, but your body is rushing. So even though if you want to try to calm your mind, it's not going to happen, because your heartbeat is like elevated already. So you need to slow down your heartbeat. So you're like tricking your body to calm down. You don't just tell your body to calm down. That only happens if you slow down your breathing. Then the body gets tricked into thinking, oh, actually, it's not a danger anymore. So it's all super psychological, right? And even right now, if we were calm and we start breathing really heavily, like our body gets in this alarm mode for no good reason at all. So we're doing the opposite. We're calming my body, tricking it, saying everything's cool. So there's specific technique, and this is one of our faculty at StudentRDH who actually is teaching it, and I also learned from her, is the box breathing technique. Have you heard about this before?
I haven't.
So imagine a box. Okay, we're just going to have a square box. Imagine a square. What you're going to do is, you can start on the right side or on the left side, whatever you want. I want to start on the right side, okay, on the left side. So imagine you have a box. You're at the very bottom of the left corner.
Okay.
You're going to breathe in. 4, 3, 2, 1. You reach the top. Then it's plateau, right? Flat part. You hold. 4, 3, 2, 1. Now you're going to exhale. You go down. 4, 3, 2, 1. Now you're going to go across. With holding the breath is 4, 3, 2, 1. So let's try it really quickly together, just twice. So we're going to breathe in and out. Okay, let's start. Breathe in. 4, 3, 2, 1. Hold. 4, 3, 2, 1. Exhale. 4, 3, 2, 1. Hold. 4, 3, 2, 1. Again, inhale. Hold. Exhale. Hold. And then inhale again. So that is basically the box breathing technique.
Okay.
So if you have a hard time following it, visualize the box. You go up the box, you hold, you come down the box, you cross. You do it a few times, and it has this like weird hypnotic, like just calming effect. Yeah, and you know, if you have the practice of doing it from year one in hygiene school, any exam you're going to take, any situation you're going to have with your patient, I think you're going to do awesome.
Okay, great. Thank you.
Yeah. Especially local anesthesia. Do you guys do it over there in Utah?
Do the what? Sorry.
Local anesthesia, the injection.
Oh, yes, I think we do.
Yeah. I mean, that one is going to be like,
yes,
shaking hands, right? You're going to poke your friend. You're going to feel like you're going to kill them.
Yes.
This is where it really needs to happen. When you're about to do local anesthesia. And when you have your first patient, oh my God.
Yeah.
But hey, you got this. Your brain already absorbed all the information. You just need to stay calm. And calm is kind of a very, I don't know, I don't really love that word calm because it kind of sounds like, oh, like, you know, you're so, you know, calm. But, you know, at the end of the day, our body likes to process things better when it is in that stage, open stage of being able to absorb things. So I'm really glad you asked about that too. Nerves. I mean, there's going to be a lot of people say they cry. I didn't cry, but you know, I had my freak out moments, like for sure.
Yeah, for sure.
Right. And again, it's a lot of things. People really, it's not just assignment, it's people. Patience, not easy. Yeah. But you got to be strong. I mean, I feel you're very mature already, so I don't worry about you actually. But patients, you know, they still can see us as students. So they're extremely nice sometimes, but sometimes, you know, they might throw us questions that makes us feel like we don't know anything too. Yeah. I'm so glad we talked, Diana, and you brought some really good points.
Well, thank you so much. I've been looking forward to this, and it's given me a lot to think about and a lot of good advice. So thank you so much.
And yeah, thanks for being here and letting us, you know, also spread the message. And, you know, you can always ask me things. You know, I'm the support at StudentRDH. I constantly make content and all of that too. If you're like, I really don't know how to memorize this, Claire, just feel free to send that, because that's how I get my ideas from you guys telling me what you guys want to learn, what you have difficulty with. You know, so we can definitely talk. You know, I constantly create videos too, so I can definitely do that. And I just wish you the best. You know, I want to hear from you though when you are in school, how it's going. I would love to. Hey, I mean, I know you don't have time, but if you kind of want to, you know, say a few things in our blog as well. This is my journey in dental hygiene school. That would be awesome too.
Yeah, I'd love to.
And remind me which school you're going to go to.
Weber State.
Weber State. Weber State. Let me see. Oh yes. That is your program director is not Jody Lopez. That's Francis McConaughey. McConaughey. That's your program director. Wow, awesome. I mean, you know, I do talk to most of the schools and faculty members too, but you know, it's really nice that you already wanted to be ready for this journey. Yes,
any little bit helps.
Yes. And you know, honestly, you know, the things that we talked about today, I try to give not like obvious advice. Because you know, everybody can tell you, oh, make good notes. Like, I mean, I don't know, duh. you know, give yourself, you know, make sure you have time for yourself. I'm like, yes, that's a given. But what's there that like people don't really talk about, that you can use your own psychology to prepare yourself. Yeah.
That
All right.
was
Well,
great.
I hope you can learn some of the things we learned, memory techniques, for sure. And you know what? Teach your children too, if you can, because that's what I love about like, or when I speak as well in conferences and things like that. We have a lot of, you know, mothers, right? And I love it when they tell me, actually, I taught my children to do their homework this way, and they learn so much better because, you know, they need that. And if they grow up with that brain, they are good.
Yeah. No, that would give them an edge up for sure. Yeah.
Awesome. Well, I can't wait to hear, you know, once you start school, how that is going.
Thank you. I'm excited too. Thank you so much.
All right. Well, take care, Diana, and good luck.
Thanks, Claire.
Bye.